afternoon to talk to everyone. We'll be talking about, as I said, angular limb deformities in the foal, and I'm just going to jump straight in to our presentation. Sorry there. So angular limb deformities, these are our bent-legged or crooked-legged foals. We tend to define these as either valgus or varus deviations. So a valgus deviation is our toed out deviation of the lower limb, so your knock-kneed or cow-hocked foals, in comparison to a varus deviation, which is a toed-in deviation of the lower limb, being sort of bow-legged or pigeon-toed. It is important to have a bit of an understanding of why these deformities develop, because it does influence how we go on to manage these cases. Conditions that the foal may be born with include periarticular laxity, which just is a softening or a laxness of the ligaments and soft tissues surrounding the joints, which gives them more mobility. We also can see aberrant ossification in utero due to malpositioning, genetic effects, and the like. The other that Aaron's touched on as well is incomplete ossification. So all bone starts out as a really soft cartilage precursor. Now, premature foals are at risk of being born before the cuboidal bones, particularly in the knee and the hock, are fully ossified. And this puts them at risk of crushing injury and fracture of the developing bones as the foal grows. Developmental deformities can occur for a number of reasons. Genetics can certainly contribute, and that can be the influence of both the dam and the sire. Dietary effects, particularly excessive energy intake, as well as imbalances. Trauma can play a role, simply just excessive exercise, injury to the growth plate, as well as excessive body weight and really rapid weight gains. All of our interventions essentially rely on our ability to either maximise or restrict growth. So it's really important that we intervene while there is still potential for significant growth at the growth plate. We have a really narrow window of opportunity for some locations, particularly the fetlock, to correct these deviations. So it's important to get in and monitor these cases early. And in the case of some of the severe deviations that we see in the newborn, they really need to be addressed early on to reduce the risk of injury to the developing joints. We assess these cases really as a team approach. It's a combination of the managers, farriers, veterinarians, and ultimately taking into account the expectations and intentions of the owner, as well as the budget for the individual foal. Factors that we take into account when looking at these foals, as we've said, includes genetics. It's really important when looking at these foals to stand them up next to mum and have a look at the mare's conformation. If she has a deviation, then that foal will be at high risk for developing a similar abnormality, and also taking into account previous foals that the mare may have had, looking at her foal's records as to whether they've suffered from deviations, as the foal again may be at risk of similar ones. That's as well as taking into account if the sire is known for throwing foals with a particular deviation. So it's important not to forget about the effect of the mare, as many people focus on the stallion. It's important in the newborn to identify if the foal is born at term or if it's premature, and whether we need to request an ossification screen or x-rays of those knees and hocks to have a look if those bones are fully developed. Important to take an eye on the foal's birth weight and then weight gains going forward. Is the foal growing too fast or too heavy? Because these body weight can compound and exacerbate angular limb deformities. When we're visually assessing these foals, we look at them at rest. And so it's really important to have a nice level, sort of even ground to look at the foal, particularly from the front and also behind. Make sure that we need to stand sort of front on to the knees and the hocks. It's not uncommon to see a rotational deformity, and it's important to stand sort of front on to the knees so that we can truly assess the angles through the different joints, as it's can be easy to miss a toed-in fetlock if we don't stand correctly onto the knee looking at these foals. It's important then to watch the foal move, so walking both away and towards us. Some of our minor deviations may be more apparent in motion. And then we may go on and pick up the limb, have a look at the unloaded limb, flex the fetlock joint and see what its motion is, as well as having a look at foot balance and heel balance. We tend to give these deformities a subjective grade. It gives us something going forward to monitor. It's really easy to forget what you think you saw. So putting a number on these simply to then give us an idea of whether the foal is responding well to the interventions or how it's changing over time. We also take note of any rotational deformities and also axial deformities, which are things like your offset or bench knee foals. So when do we assess these foals? It's really important that they get assessed from day one, particularly with respect to whether they may need early sort of store confinement. So these are your foals with that are windswept, so that's significant sort of periarticular laxity. And also, if the foal is premature, we take our X-ray screen of those knees and hocks. If there's a moderate lack of ossification, then these foals will need confinement to reduce the risk of injury to those developing bones. And if there's a severe lack of ossification, then these foals may have a poor prognosis for athletic performance and long-term soundness, and that really should be discussed with the owner from the outset. Going forward, we'll monitor these confined foals usually sort of by 10 to 14 days to determine whether they're ready for increasing turnout. So judging if our periarticular laxity and windswept appearance has corrected adequately. It's the time when we'll repeat our X-rays on those premature foals and see how those bones are developing, again, to see if they can start a bit more turnout. We'll also like to get a baseline on most of our foals by this point, just to give us something to monitor going forward. Week 4, we're reassessing, and usually this is when most of our foals will have their first farrier handling. In many cases, it may simply be just a light rasp, keeping the feet balanced, and we may also then start some other interventions, as we'll discuss. Going forward, most of our relatively correct foals, we'll monitor them every 4 weeks, whereas foals that have a deviation or that we consider at high risk, say, of developing a fetlock varus or a toed-in fetlock early on, we may monitor those fortnightly just to give us time to intervene. So interventions that we have at hand, the first of which is confinement, as we've discussed for our windswept foals or those premature foals with incompletely ossified bones. If we can help it, we try to avoid confining them for longer than a month. Just increases the risk of OCD and other developmental orthopedic disease, as well as potentially leading to excessive weight gains. It's really important not to underestimate the benefits of good farriery in these cases. So having a good relationship with your farriers is really important. They're often the first port of call with many of our interventions in these foals. And this, as I said, may simply be a light trimming to keep the feet balanced, just simple rasping. We then may use extensions to try and correct our deviations and alter the loading across the growth plates. We tend to probably reach for this more now than trying to lower one side of the foot or the other. We then have a couple of surgeries up our sleeves. Periosteal stripping aims to increase the growth on the shorter side of the limb. It is contentious because there is limited evidence for its benefit. And we know that a lot of the higher deviations, so your hocks and your knees, they will correct quite often on their own or with sort of less intensive intervention. But there are still a select few cases that we will use a periosteal strip in, and that's generally done during the sort of fast phase of growth. Transphyseal bridging is our main surgery, and this involves placing an implant across the growth plate to slow down the growth on the longer side of the limb. So it does involve 2 surgeries, one to place the implant and another to remove it. For these cases, sterility is really important and to reduce the risk of infection, as is good anaesthesia to give us our best chance of a safe recovery for the foal. We are tending to remove a lot of our fetlock bridge screws standing now. Does reduce the risk of a second anaesthetic, but does slightly increase the risk of infection, which can have effects on cosmesis. We tend to do it in cases where the bridge hasn't been in for too long and where we've got a suitable area to perform the surgery. And then Early weaning is another intervention that we shouldn't forget about. So our heavy foals are those that are growing rapidly. Heavy body weights, as we said, will compound or potentially worsen ALDs. So need to not forget about the option of potentially taking the foal off the mare early so that we can control their diet and their energy intake. So when do we get involved? When we intervene really depends on the location of the deformity, its severity, and the age of the foal. For our fetlocks, their fast growth period is the first 2 months of life. We generally, our first interventions will be our farriery, so keeping those feet balanced and potentially the use of extensions. It's important to note, particularly with the fetlock, that while our extensions are in place on the feet, that some of these deviations can look quite good. And when the extension is removed, the deformity can potentially appear to regress or worsen again. So it may be worth assessing the foal without the extension while we still have a little bit of time at the end to intervene for this location. We do still strip a number of these cases. Usually if that's done, it will be done about a month of age. Most commonly, we are reaching for the transphyseal bridge in cases that aren't responding to our trimming and extensions, however, and they tend to go in around 10 to 12 weeks of age with just a single screw across the growth plate. We have followed up probably about 250 of these cases onto the racetrack, and we haven't found any detrimental effect of the surgery on racing potential. So it is a really effective surgery with a good outcome. So for our hocks, the fast growth period is that first sort of 4 months of age, so over a sort of longer period. As we've noted, those early severely windswept foals, early confinement, a lot of these will correct quite dramatically. Not to forget the importance of trimming, potentially the use of extensions. For those higher deformities, so the knees and the hocks, we tend to be a little bit cautious in the first couple of months with applying extensions, just while those fetlocks down lower are going through their fast growth phase, just for a little bit of a risk of inducing a secondary deformity at the fetlock, but generally is fine after this period. We don't tend to strip for hocks, and transphyseal bridging is not a common surgery that we'll perform. We'll do a few a year. Timing sort of varies, but around 4 to 6 months of age, with the growth plate being open much later than a fetlock. And finally, our knees, they have their fast growth period over the first 6 months of life. As we've said early on, stall confinement for those severely windswept foals is important to reduce the risk of joint injury and fracture to those cuboidal bones when the deviations are quite severe. Many of them, as we said, will respond really well, just to stall rest and straighten up quite well. Important not to forget, while those foals are confined and locked up, to do nothing with them. Really important to continue to have the foal assessed by a farrier as well, and maintaining that foot balance and potentially extensions later on. We know that many of these deformities will tend to improve with our conservative treatments. So we do still strip a select number of cases, but not too many. Transphyseal bridging is our sort of more intensive surgery. In those severe windswept cases that we're confining from birth, if they're not showing improvement in that first month with stall confinement that's significant, we can potentially bridge some of these foals even from 1 to 2 months of age. Just as we've said, that severe deformity does risk injury to the bones in the knees. Beyond that, the time for sort of intervention really varies with the severity of the deformity. More moderate cases, we may continue to manage conservatively and keep an eye on how the deformity is correcting. We have really sort of getting up even to 9, 12 months of age. If the deviation is mild, we can put bridges in at this age and still expect a good outcome. All just depends on the severity of the deformity. There's 2 types of surgeries that we'll use for the knee, a tension band wire like we can see in the x-ray here, or a single screw like the fetlock, and that really just depends on the age of the foal. There have been numerous studies that have looked at racing outcomes after having had bridges across the distal radius for the knees. And again, they've shown no detrimental effect of the surgery on racing potential. There's one question here on, do I believe stripping works? As you said, it's very contentious. Certainly those higher deformities like those knees and hocks, we know they tend to respond quite well to conservative management. We do a number of strips for fetlocks, certainly nowhere near as many as we used to, may have some benefit. Certainly we know we get a decent response with our bridging, so a more aggressive surgery. Obviously it's more expensive, needs 2 surgeries, but certainly there is debate as to how effective the periosteal stripping surgery is. We had one question here, how much weight should a foal be putting on a day to minimise the risk of ALD? I don't know that I can answer that question directly. I guess we're just looking at, is the foal proportionately to its size gaining excessive weight and starting to look too heavy and chunky for what it should be. One question here, can you see the effects of screws in x-rays at a later date, such as yearling x-rays? Generally not by the time the foal is a yearling, occasionally at weanling age. So if it's only a couple of months, say since a fetlock bridge has been removed, you can still see a little bit of a defect from where the screw was in place, a bit of a lucency. It's quite obvious that that is from a bridge. Sometimes there'll be a very small lump on the side of the cannon where the screw head was. It's a very well-known surgery and most people know that's why they've been placed. So I don't think anyone would think negatively of having, noting that on an x-ray. But generally, by the time the foals are yearling, certainly most of those things have gone away. If you'd had a recent knee bridge, you might still potentially see, but yeah.